Good afternoon, Nicholas Roche. I am Mihiraa. Let's begin the warm-up session. Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, I will develop a nursing care plan and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Your preparation time is over. You can now start your OET speaking roleplay.
Hello there. My name is Nicholas Roche. I'm one of the nurses working in the emergency department today. I can see you're looking quite uncomfortable. I'm here to help you, so let's see what we can do to make you feel better. To start with, could you please tell me in your own words what's brought you to see us today?
Oh, thank you. It's a really sharp pain, low down in my abdomen, that started yesterday afternoon. The pain is the worst part. It's a really sharp pain every time I try to pass urine. It just hasn't gone away, and it's actually getting worse. I knew I had to come in.
I'm sorry to hear you've been in such pain. That sounds very distressing. Before we proceed, may I know your name for the documentation?
Sure, my name is Mihiraa.
To help me understand what might be going on, Mihiraa, I need to ask you a few more specific questions about what you're experiencing. Let's start by talking about the pain itself. Can you describe for me the specific sensations you're feeling?
It's a really sharp, burning feeling every single time I try to go. It's awful. And it's like I need to go all the time, even if almost nothing comes out. The urine itself looks a bit dark and smells strange, which is what really worried me.
I understand that burning sensation and urgency are very classic and uncomfortable symptoms. Thank you for describing that so clearly. Besides these issues with urination, Mihiraa, have you noticed any other changes in how you're feeling overall? For instance, are you running a temperature, feeling unusually tired, or experiencing any pain in other areas like your back or lower abdomen?
Now that you mention it, I do feel a bit feverish and shivery, and I'm just exhausted. I also have a dull ache in my lower back, which is new. I just thought I was run down.
That's very helpful to know. Thank you. Those are all important pieces of the puzzle. To get a complete picture of your health, I also need to ask about a few factors that can sometimes contribute to these kinds of symptoms. Have you had a urinary tract infection like this before? Mihiraa, I'd also like to ask about things like your recent hydration levels, any recent medical procedures, or changes in your personal life that might be relevant.
I had one UTI a few years ago, but it wasn't nearly this bad. I've been so busy at work that I know I haven't been drinking enough water lately. And no procedures or anything like that.
Thank you for sharing that with me, Mihiraa. That really helps me understand what you're going through. Let me walk you through what we'll do next so you know exactly what to expect. The first and most important step is for you to see the doctor to get a proper diagnosis, and to help them do that, we'll begin by collecting a small urine sample. I'll bring you a sterile kit and explain exactly how to do it to ensure we get a clean sample. Once we have it, I'll run a quick initial test right here with a dipstick, which gives us some immediate clues about a possible infection within just a few minutes. If that test suggests an infection, we'll then send the same sample to our laboratory for a more thorough analysis. This isn't something you need to wait for, but it helps the doctor pinpoint the exact type of bacteria to make sure we choose the most effective antibiotic for you. Once all the results are in, the doctor will sit down with you, go over everything they've found, and talk you through the treatment plan, which will most likely involve a course of antibiotics to clear this up and get you comfortable again.
Okay, that makes sense. So the dipstick test is first. How long will that take? And will that be enough to resolve my pain? It's becoming intolerable.
The initial test is very quick, and we'll have those results in just a few minutes. I know this is a very distressing and painful experience, but I want to reassure you that you are experiencing something incredibly common, and most importantly, it is very easily treatable. We see cases like this every single day, and with a short course of antibiotics, patients often start feeling relief very quickly. So while it feels overwhelming right now, please know there is absolutely no cause for long-term concern. The best way to get you on that path to relief is to get a definitive diagnosis from the doctor. And fortunately, the department is quite calm at the moment, which means you won't be waiting long to be seen. Getting that official diagnosis is the quickest and safest way to know exactly what we're dealing with, so we can get you the right treatment and have you feeling like yourself again.
That's a relief to hear. I was worried it was something more serious. So what do I need to do now?
The next step is for you to provide that urine sample so we can begin the testing. So, do I have your consent to proceed with this plan and to see the doctor?
Yes, absolutely. Please, let's go ahead with the plan. I just want to start feeling better. Thank you for explaining everything so clearly.
Thank you, Mihiraa, for your understanding. Please wait in the waiting area. The doctor will see you soon.